On 25th February 2022, Minister of Health and Family Welfare James P.K. SANGMA inaugurated Phase 2 of the Icmr-Stemi Act project at the Banquet Hall, Pinewood Hotel, Shillong. Others present included Commissioner and Secretary Health and Family Welfare Department M.N. NAMPUI, Secretary Health and Family Welfare Department R.M. KURBAH, DHS MI Dr. AMAN, besides others. Speaking on the occasion, James P.K. SANGMA expressed his gratitude to NAGRIMS Hospital for bringing the particular project to the state of Meghalaya that will benefit patients, especially those of the lower income group, as the clot buster machine will be provided free of cost to all eligible patients. While NAGRIMS will be the hub or common center, 8 hospitals in Shillong, including Civil Hospital, Ganesh Das Government Maternity and Child Health Hospital, Reed Provincial Chest Hospital, Dr. H. Gordon Roberts Hospital, Nazareth Hospital, Woodland Hospital, Supercare Hospital and Bethany Hospital will be the spoke centers.
And I would like to first and foremost place on record our sincere thanks to Professor Nalin Mehta ji and his entire team at NAGRIMS, ICMR, and also, of course, our officials and our doctors of the health department to bring about this marriage of technology and medicine and bring forth this intervention, which I have full belief and faith that this will bring about an environment which will save so many lives in the future. And for this, we are indeed very grateful to Professor Nalin Mehta ji and his entire team for having come up with the ideas and for having partnered with the government of Meghalaya to bring this about. That this is indeed something of a need which was urgently required, and I think that it's not just about the fact that the medicines will come free of cost, and these are very expensive medicines, mind you, costing from about 20,000 to 25,000. And these expensive medicines are sometimes not affordable by many people, especially economically weaker sections. And it's not just about the fact that these medicines will come free of cost, but the fact, as was already explained to us, that in an instance when we are all rushing for the golden period of 90 minutes, wherein a cardiologist is not available, that is that point of time where a matter of few minutes here and there can cost the life of a person having cardiac arrest. And this is really something that by bringing technology, by having an app which will ensure that the ECG, whichever is taken of the patient, will be referred to the cardiologist at NAGRIMS, and immediately within a matter of few minutes, whether this medicine can be administered or not will be prescribed by the concerned cardiologist.
Director of NAGRIMS, Dr. Nalin Mehta, informed that the project focuses on timely intervention in cases of heart attacks and saving precious lives by initiating treatment of blocked arteries within the golden hour or the first 90 minutes of the attack by administering clot buster or thrombolytic medicines to the patient.
So this particular project, wherein I would say it's a matter of pride for Meghalaya that we have been chosen as the hub for the Northeast region, and the Department of Health has been extremely cooperative. We have had support from 8 hospitals within Shillong to serve the people of Shillong, and this medication, which is pretty expensive otherwise, will benefit especially those who can't afford it. I would reiterate that when somebody has a heart attack, some of which can be treated through intervention but some require this medication, unfortunately because of the time taken to reach the hospital and also some patients not being eligible for thrombolysis, despite the expensive medication, they do not get the benefit because at times they reach hospitals where they may not have a cardiologist at hand immediately.